news today. So this is still really fresh for them. Why did we do this today? Why did we choose to have a press conference to talk about this? And the way that I say this is because this is a big deal. And we have known that we've had measles in our community. We are now seeing a very serious consequence of what happens when we have measles in our community. And so we just feel like it's our obligation. I will tell you, actually, I'm the chief executive of the 4 Covenant hospitals here in Lubbock. But what I really am is a pediatrician. So I was a pediatrician for many years before I was a hospital administrator. And so this hits very close to home for us just because of our love for children. So as of today, more than 20 patients have been admitted to the Covenant Children's Hospital. We have several of those who have required intensive care as a result of having the measles. And as you can see from today's news, this virus can have severe and deadly consequences. We want to urge our communities to be vigilant, and you'll hear kind of the second part of what we want to do today is just continue to provide an opportunity for some education and questions about the measles. We want you to educate yourself with information from reliable sources like the city and state health authorities, so thank you guys for being here with us today, and of course information that we provide here. We also want to continue to emphasize that vaccination is the best way to prevent the spread of this virus and to prevent the severe complications. Dr. Johnson, who is our Chief Medical Officer, will share some of the truths about measles and some of the questions and specific things that we are doing. And so we did want to put on the screen, because we know that vaccination is the best way to prevent these complications, we just wanted to put dates and times that the City Health Department is holding their vaccine clinics. Thank you guys for just being with us today. We hope we will answer many questions, but like I said, the 2 biggest reasons that we are here is we just want to be able to talk about what's happening in our community and then be able to provide good educational resources and information. I do want to say just one quick word about my caregivers. So at Covenant Health, we call all employees that work in our hospital caregivers, from everybody who takes care of a patient to anybody that works in the billing office. We believe that we're all here to take care of patients. And I do want to say that this, my caregivers have been fantastic in the middle of this outbreak, and I would just ask you to keep them in your thoughts and prayers as well. This has been hard on them as we have had so many kids coming in, and then obviously we were not prepared probably so early in what we're seeing to already have a death that's attributed to this. So I do also want to say that the efforts that we have done are not, we have many departments and staff that have helped us take care of this. I remain to be impressed by our staff and just the quick way that we have set up. You'll hear Dr. Johnson talk about, we have set up a shed, for the lack of a better term, where we are pre-screening patients before they come into our emergency room. And just the quick way that we have been able to set up so many things in our hospital to ensure that you're safe. Dr. Johnson will go in to all of these things, but the other thing that we want to emphasize today is we want to emphasize the safety that you can expect if you come to the hospital, and just the different precautions and things that we are doing. So it is my pleasure to introduce Dr. Laura Johnson, who is our Chief Medical Officer, and she's going to have some more specific information on measles, and then at the end of what she talks about, we'll be happy to take some questions. Thank you.
Thank you. I am also a pediatrician and a pediatric hospitalist, and have had the opportunity to participate in the care of some of the measles patients that we've seen in the hospital. So I just want to reemphasize some of the things that Dr. Thompson has already said. We've seen about 20 patients who've required hospitalization with confirmed measles, as well as a handful of patients who presented to our emergency department but did not require ongoing hospitalization. For these patients, they've ranged in ages from infants, school-age children predominantly, and some older children as well. What we see with these patients is really what we see classically with measles. So in general, the clinical presentation of measles is one that has high fever associated with it, and then a constellation of respiratory symptoms, red, watery eyes, significant nasal congestion, and cough are the hallmark symptoms, and then proceeding with a rash. And that rash is pretty characteristic, starts generally on the face and then spreads down the body. So one of the questions that I get asked a lot is, why have patients needed to be in the hospital in this situation? And the answer is really because of those respiratory symptoms. Measles is a respiratory virus that causes a viral pneumonia that may necessitate some extra support for those patients while they're trying to recover. And so we've had patients who've required treatment with supplemental oxygen and sometimes higher levels of oxygen in order to help them with their breathing while they're recovering. Measles is an incredibly contagious virus. So one of the reasons why we see an outbreak situation is because measles is very contagious and spreads really easily among those who are susceptible or who aren't immune. So we know if you're in a room with someone with active contagious measles, you have about a 90% chance of contracting that illness if you are not immune. So a very contagious virus. It's an airborne spread, so spreads via particles in the air. Certainly, just to talk a little bit about what we've been doing at Covenant Children's in terms of taking care of the community during this time, Dr. Thompson alluded to some efforts in our emergency department to make sure that when patients are coming in, we're able to screen and kind of touch base as to whether we're concerned that they might have measles, so that any patient presenting with suspected measles, we can just treat a little bit differently, taking directly back to a room to avoid having them in the waiting room or potentially exposing other patients and families. Certainly there are any number of recommendations in terms of making sure that we're appropriately taking care of patients in the hospital, what we call isolation precautions. We have special negative pressure rooms that these patients are placed in, and then healthcare providers and others taking care of the patients use appropriate PPE or personal protective equipment, including N95 masks and things like this, to reduce the risk of spread of the virus. I think just one other thing that I want to touch base on that is so important is, the best way to contain a measles outbreak is through vaccination. We're very lucky to have an extremely effective vaccine for measles. Having 2 doses of measles vaccine confers 97% lifetime immunity. So for those of us who are fully vaccinated against measles, the risk, a lot of people are worried about what's your risk in the community. Your risk is extremely, extremely low of having any issues at all with measles. The risk with measles is really for those who are not immune, who have not been vaccinated. And in that population, as I said, it spreads very, very quickly. So certainly we mentioned that we've got some information about vaccination clinics that the City of Lubbock Health Department has made available, including over the weekend. I really encourage everyone to make sure you know your vaccination status, and if you're not fully vaccinated, if your children aren't fully vaccinated, this is a great time to take advantage of these opportunities in order to be fully vaccinated, to protect yourself and your family during this outbreak. I think those are the major points that I wanted to talk about, so I think we can transition to questions.
Dr. Johnson, hold on 1 second.
Yeah.
We're getting a little bit of sound
A little,
issues.
yep.
If I turn that off and we just use your microphones, is that better? Go for it, Dr.
Okay, great. Yes, question.
I'll ask one question, I'll come back later, but we've talked to parents of little ones.
Sure.
Under 1 year old who can't get the measles vaccine.
Sure.
What do you tell those worried parents who feel their kids are susceptible and they don't even want to take them out?
Right. So, this time of year, this is respiratory season anyway. Independent of the measles outbreak, we have cold and flu viruses and all of those things. And I would say for young infants who are too young to be vaccinated, we want to be cautious about community exposures for measles, but also for all the other viruses, RSV, flu, et cetera, that circulate this time of year. So that usual precaution about just avoiding interaction with crowds and all of those kinds of things for those infants is appropriate. Now, I do think it's important to communicate with your physician for infants, especially 6 to 12 months. So that population is a little bit different only because we can, in certain contexts, give the measles vaccine early. That's a conversation to have with your pediatrician. It's not been universally recommended yet for all the areas that are impacted by the outbreak, but it is a conversation that can happen. And certainly if those younger infants are exposed. So, for example, if a 7 or 8 month old had a known exposure, we would absolutely want to immunize that infant within the first 72 hours of that exposure. That's the most effective, what we call post-exposure prophylaxis, to try to limit the risk of that infant contracting measles.
And I'll just add to that. She talked about, this is respiratory season. And sadly, we also experience, unfortunately, childhood deaths from flu and RSV and other viruses. And that's why I would underscore the stuff that you know to do. Wash your hands a lot. When you go to the supermarket, wipe off there are things. Wash your hands. Stay away from people who are sick. Like some of those things, because we're talking today specifically about measles, but unfortunately there are also deaths that happen from some of these other common viruses as well.
Sure.
What was the age of the child who passed, and did they have other comorbidities?
So I can't get into specific details about the patient. I can tell you the child was a school-age child, but other than that, I really can't get into any further details.
Based on the numbers of measles, and you have one death now, was it inevitable that you would see a death here, and do you think there could be more?
I think what we need to know about measles is a very severe illness that has a mortality rate of about 3%. And so knowing that when we have large outbreaks, unfortunately, statistically, there's a significant risk of having a death. I certainly hope we don't see any more, but I think we're fairly early still in this outbreak. This has been going on about 4 weeks. We see the numbers increasing pretty dramatically with each update, and so I think we're just going to have to see what happens.
And
Yeah.
As sad as it is, can you paint a picture of how serious it is? A lot of people think measles is a lot of spots and a fever.
Sure.
But really, if you could describe what it's like to die from measles, or can you not breathe, or the swelling? Can you explain how difficult that is, how dangerous it is?
Sure. First of all, measles is a deadly virus, as we just talked about. So measles can be very dangerous. The predominant issues that we talk about, and certainly that have led patients to be admitted to the hospital, are those respiratory issues. And so that is a frequent cause of death. There are also neurologic issues that can happen acutely, encephalitis, swelling of the brain, blindness, other issues along that line that can also be a part of acute measles. And then what we don't talk about as often because it's something that happens after, but there is an additional neurologic complication that occurs years later after measles infection. That is a fatal neurologic complication that can occur 7 years after the initial infection. So measles is very serious. There are lots of childhood rashes and fevers, and as parents, we all know that our kids get these here and there. This is not that. This is a much more serious illness that has much greater risk of serious complications.
And I should say, just because I just mentioned these other viruses, 3% is a high percentage of complications from the measles. That's a higher percentage. While we do see deaths with other viruses and stuff, it is not at that 3% level. So 3% is a high complication rate. Yes.
Was this student, or was this school-age student in kind of public schools, or is that something you can hint at?
I really can't give you any specific details about any particular patient. So I'm sorry about that. Yes.
I've got a few questions. In the community, we've been seeing and hearing a lot of people seizing on the fact that there are a few vaccinated cases to argue, vaccines don't make a difference. Are any of your hospitalized patients vaccinated? And what do you just say generally to the people who say, see, there are some vaccinated cases here, so vaccines don't matter.
Yeah, the patients who have been hospitalized, they've all been unvaccinated. And I think it can be hard in the midst of an outbreak when we're hearing a lot of information and when sometimes people may report that they've been vaccinated and, how certain are we of that? What I would say is the best data really speaks to the overall vaccine efficacy, which is 93% for one dose and 97% for two. And I think that, that's an important thing to hold in our hands about how well the vaccine works, knowing those numbers.
And then what would you say to people who say that the outbreak in Texas isn't unusual, that measles outbreaks happen every year in America?
Sure. So I graduated from medical school in 2002. And when I graduated from medical school, I was confident I would never see a measles outbreak unless I chose to work internationally, because at that time, we were confident that we'd eradicated measles from the United States and had really gotten to a point where we just didn't see these kinds of outbreaks happening. Obviously, that has changed over the last 20-something years. And so we do see outbreaks more frequently, but that is related to how much we're vaccinating our population. When we think about vaccine-preventable illnesses, they're only preventable if we have adequate vaccination rates. And as we see those rates start to decline, across the nation, then we'll see more outbreaks. Because if you have high vaccination rates, then even when you do have a case here or a case there, or a little outbreak here or a little outbreak there, it can't spread. Because you have this cocoon of non-susceptible individuals who are vaccinated, and therefore the virus doesn't go anywhere. When you have individuals who aren't immune, then that gives the virus the opportunity to spread really rapidly. So it is different. It is different than it was, 20-something years ago. We are seeing more of these outbreaks, for sure.
And lastly, were you involved at all in the care of this patient who died?
I was not involved with this particular patient, but I have seen some of the other measles patients that we've cared for. Yes?
Of all the patients that you've seen, hospitalized and just coming to visit for checkups with measles, are you seeing more severe cases in unvaccinated people?
Yes. So, in general, almost all the cases are in unvaccinated people. I think it's important to kind of hold that, not only the hospitalized cases, but even the cases just in general that have been reported. So measles cases in vaccinated people are extremely rare. And I can't speak to the reports of, individuals who may have been vaccinated who may have tested positive. So I can't get into that, but I think it's just important to recognize that measles in someone who's vaccinated is an extremely unusual occurrence. Yeah.
Just to follow up here. HHS Secretary RFK Jr. was at the White House speaking today and mentioned the outbreak here in West Texas, but he also said the majority of the hospitalizations were for quarantine. You're making it sound they're not quarantining here.
So we don't hospitalize patients for quarantine purposes. So quarantine, certainly if you've had an exposure, there are indications to quarantine in the context of measles, but that quarantine is not something that would happen in a healthcare facility. We admit patients who need acute supportive treatment in our hospital.
So if they're here, they're getting, tell us again, what kind of treatment?
So that generally, it's what we call supportive care, which is primarily because of the respiratory issues going to be respiratory support. So supplemental oxygen, maybe high flow oxygen, escalating that support as needed. Most of the time patients certainly have high fevers. We're going to give medicines for the fever. They may need IV fluids and support in that fashion because they're not feeling well and ill. And then obviously, depending on the complications, there may be other things that are needed. Yeah. Yes?
Just to confirm the number of patients you've seen, is it about 20 or more than 20?
That's a good question. So I think about 20 is the number I'm going to lean in on in terms of the patients who've been hospitalized. Yeah, absolutely. Yes.
Does the effectiveness of the vaccine change depending on the age range versus
So yes, in the sense of if we give the vaccine early, 6 to 12 months, that may not confer as much lifelong immunity. So in general, if you give the vaccine early, there may be a recommendation to get an additional dose later, so a total of 3 rather than a total of 2. But if there's been an exposure or a consideration in the situation of an outbreak, that may be a reasonable decision to make.
And when would you recommend that third dose?
So there is kind of a recommended schedule. The usual schedule is 12 months and then 4 years. And so that third dose happens, it has somewhere in there. But that's something that can kind of be worked out with the pediatrician.
Do we have any identified adult cases of measles currently?
We do not have any hospitalized adults, but we have seen some adult patients with measles, yes.
And also, if in doubt, if there's anybody that has not had, or they don't remember or have records
Right.
of child vaccine, where should they go? Where should they find that information?
So if you're uncertain, I would go to the health department and receive a vaccine. I think that's the best answer. Certainly, depending on the age of the person, the ability to have records of that previous vaccine may vary. We've had an immunization tracking program in Texas for many years. So younger people, we may be able to identify that if they've been in that tracking, but certainly someone who's my age might not know. And so I think that's always it's always a good conversation to have with your healthcare provider. But in this context, if you're not sure of your immunity status, I would get a vaccine because that's going to be the best protection.
And I'm gonna add to this 2 things. Number 1, this will tell you how I'm older than her. And so when I was a tech student, we actually had some cases of rubella. And that is, if you think of MMR vaccine, that's measles, mumps, and rubella. And so when I was a college student, I actually had to get another MMR because they had enough rubella cases that we were all required. And so the reason I want to say that is there's not harm in, if you don't know, that the default is you can have another vaccination. So because we did that with that rubella outbreak. The other year, and I'm looking to you and you to make sure that this is right, but there is a year if you were vaccinated before, and I think it's 1957. Is that 57? Okay. If you were vaccinated before 1957, you should absolutely talk to your physician to make sure that you 67, not 57.
Yeah. If you were born before 1957, then you probably had measles because that was when we didn't have vaccination, and so there is that. Almost everyone born before 1957 has immunity because they had measles when they were young. There was a period of time with vaccination that was perhaps just different than our current vaccine. So there are those considerations.
Yeah, thank you. I wanted to make sure we had that.
You talked about safeguarding your handling the hospital. So what would it look like if I went into PDSU right now? Does it look like it did during COVID when you had the protective gear and you're spraying? What does it look like?
Yeah, it's a good question. And we've talked a lot today, and I'll be honest, I joke, you're going to be the first one that said COVID, not me. And the reason I say it is because we want to be really careful today. The last time I did one of these press conferences was unfortunately when we lost a kid with complications of COVID. But I do want to first say this is not COVID. And that's a super important thing to point out. This is a whole different thing than what we were seeing in the COVID epidemic. You're going to hear some of the similar, things, but it's a very different thing because this is a vaccine preventable disease that we had eradicated, and you also treat differently than what was happening in COVID. And so, like, you were getting questions, about should everybody be masking? Well, I mean, the reason that the answer to that is no is because if you have the vaccine, you're not going to get the measles, and you're not going to be somebody who's going to give it. And so it's just a different context. But the answer to your question is we've got safeguards. I actually see some of our folks from Covenant Medical Group that are here with us. Even in the clinic setting, we have things set up as this measles outbreak that, I'll give an example. At our urgent care centers, we're asking patients if they have some of these symptoms to stay in the car, and then we're coming out and doing those things. We talked about this shed that we have at the Children's Hospital where we're screening everybody that walks into our emergency room. And if we see anything that looks like this, then we are taking them directly to a room. We're putting masks on, and then Dr. Johnson talked about this negative pressure. And so what the negative pressure rooms do is allow you to not allow any of that infected air, essentially, to go out of that room. And so it's on a separate kind of system that's going to take that air in a different way. So we have all of those things. We did use, for whatever it's worth, negative pressure rooms and things in COVID. So that's where we have the technology to set the rooms up. We have, I don't know, over 20 rooms at this point that we have went ahead and set up at the Children's Hospital, because if we have more patients, we want to make sure that we're set up for those patients in negative pressure rooms. I'll tell you the one thing that if I wanted to compare it to COVID, what is my number one concern? And one of the things we want to make sure that we communicate today. During COVID, one of the things that I saw that distressed me the most is people who were choosing not to come in for health care because of fear, if that makes sense, like of coming to an emergency room or something like this. And I want to make sure that we get the message out today. Like, we have precautions in place. If you are vaccinated, you are protected. And this is not the time to not bring kids in for other care. So if you have a kid who is having an asthma exacerbation, it is safe for you to come to the hospital. We're going to have a process where we can, do the screening. And even if you're admitted to the hospital, you're in a safe environment where you're not going to contract the measles by just being in the hospital, if that makes sense. And that's an important part that I did see during the COVID epidemic, was people afraid to come in. And so that's an important thing for us to point out, that we've put safeguards in place.
You're wearing protective gear, so are you wearing?
We are. And that's those isolation precautions that we talk about. And so there's different isolation precautions based on how something is contracted. And so there's some things that are contact isolation. So if you touch something that someone has breathed on, essentially, that have had spittle on, you can contract that way. There's some respiratory things. There's airborne. There's some different ways that you can contract. So based on measles, we have you on specific isolation that includes negative pressure and includes masking. And we talked about the N95. So we have specific isolation requirements that we do specifically for measles. And I'll contrast it with RSV, which I've already mentioned today. That's different precautions than we would put you on if you had RSV. So we're very specific to those viruses in terms of how we isolate you.
Well, it's not COVID, it is 12 to 18 times more infectious, is that correct?
I don't know what the 12 to 18, I don't know if that's, but the answer is it's one of the most, measles is one of the most infectious agents that we know. So I don't know if that's the actual number, but it's very high.
Although we know that there's a large number of these cases originating from Gaines County, do we know where this strain originally came from? It doesn't just manifest itself. Do we know how it started in Gaines County?
I don't think we know that. I can't speak to that. That is part of the overall public health response, is doing investigation into that. But it's hard to know. Certainly there are sporadic cases that pop up here and there. I know there was a case reported in Houston and earlier in 25, and there have been cases reported in a number of states, outside of an outbreak situation so far this year. So I can't speak to exactly how the measles virus found itself in Gaines County, but we'll continue to look at it, or the public health team will. Yeah. Yes.
Requests for more involvement from the federal government that you know of?
So, I would really lean in on our partnership with the local, state, and federal health authorities. So we've had good communication with our local health department. We've had good communication with the state health department and have had visits here. And then there's also been involvement with the CDC as well. So those processes have been working, just as they're supposed to.
Talk about the calls that y'all, not only is communication, but there's calls that you guys are getting on.
Sure, yeah. So both kind of through all those levels, we've had communication that, has not just been a phone call here or there, but organized calls to make sure that calls for providers, calls for the hospitals, calls, communication across all the different stakeholders to make sure that we're all communicating. And as we're identifying additional needs or resource needs, we're able to raise those to both the local and the state authorities to assist with that.
Do you think there should be more federal involvement at this point?
I think from our perspective here locally, things are going about as well as they could be in this context, and I think we've been very appreciative of the collaboration with the health departments, both locally and at the state level. Yes.
I'm hearing from health officials in other cities that they were told to put a hold on sending vaccinated cases to the state health offices, and it's created somewhat of a delay for them. Is that something y'all are experiencing here?
I'm not sure. Maybe could you clarify what you mean about vaccinated cases? I'm not sure.
The cases that come up in people who are already vaccinated, other officials have said that the state health offices are putting a hold on sending those results over to them, but y'all are sending over the unvaccinated results. Is that how?
I don't believe so. No, I mean, we're testing as indicated by the clinical findings and collaborating with the local and state health departments to run those tests and get the results. So I'm not aware of any concerns with that.
As I understand it, no vaccine is 100% effective. So what does that mean? If somebody has one of the 2-dose series, are they protected enough to avoid death?
So they're 93% effective, 93% protected in the sense that they are unlikely to contract the virus. Whereas if you're unvaccinated, if you're around someone who has the illness, you have a 90% chance of becoming ill from the virus. When we say the vaccine is 93% effective, that means, I suppose, if we took 100 vaccinated people and put them in a room with someone with measles, you can kind of do the math from there. But almost all of those vaccinated people, 93%, would not contract the illness at all. So, the degree to which, for those who do become ill, certainly the symptoms are far less. I can't speak to more details beyond that, but measles vaccine is one of our most effective vaccines. So some vaccines, and I think maybe COVID and flu we could think about in this category, don't necessarily protect you completely from getting ill at all, but they lessen the symptoms, make complications and hospitalizations more rare, those kinds of things. Measles vaccine is one of those great examples of a vaccine that really keeps you from getting sick almost all the time. Completely. And so it's often, an example of one of our most effective vaccines from that standpoint.
And I would also, the only other thing I would add on that is keep in mind that there are many things that happen over your lifespan. And so, I'm going to speak because we've got a cancer center here in our hospital. And so certainly when you have cancer patients or things like this that are going on chemotherapeutic drugs, what that does is knock down your body's own ability to fight off disease and immunity and those things. And so when we talk sometimes about who gets sick, from these things, you have to keep in mind that what you also have in that category is people like cancer patients who are on treatment protocols that actually lessen their ability to fight off any number of diseases, but would also be in that category of someone. So that's an important consideration, is to remember you're not talking, when you're talking the 93% of people, and then the 97 whenever you're fully vaccinated, you also have in that number people who either have an immunodeficiency, so they have some genetic reason why they don't do so well with fighting off disease, or people who are on treatments like chemotherapy who knock down their ability to fight off disease. And so my point is, it's all comers that are part of that equation. It doesn't assume that everybody has a fully functioning immune system.
I'm looking at my phone. HHS Secretary said there was 2 deaths today at the White House. You only know of 1 here? I'm
only aware of the 1 death that has been reported. Yes.
Are there other complications that make it more likely, maybe more people more at risk for worse conditions after contracting measles, or more likely to catch measles, or to get the vaccine?
Yeah, so age, we've already kind of touched on. Age is a big factor, both in terms of when you can be vaccinated, and also younger infants may be more likely to have more significant symptoms. Immunocompromise that Dr. Thompson mentioned. So if you have issues with your immune system for whatever reason, that certainly can make it more likely that you might have complications and more difficulty with measles. And those are the big categories we worry about. Now, it's certainly true, just in general, patients who have more medical complications. Sometimes we think about medically complex children, especially who may have significant problems in a number of different ways. They're at greater risk for every infection, may have more severe courses and more issues with that.
And somebody asked the question earlier about the term comorbidities. That's a term that she's talking about, is if you have comorbidities. And while we can not comment on, the particular patient that we're talking about today, certainly patients that have comorbidities, we know this, patients who have underlying asthma or something can have more respiratory issues when they get any virus. And if you were a former premature infant, and so that kind of broad category that Dr. Johnson is talking about with comorbidities is always going to increase the severity. If you have respiratory issues, when you get a respiratory virus, that's going to be worse for you.
Given that so many of these cases are coming from rural communities, has that made anything more challenging in responding to this outbreak?
I would just say here in Lubbock, Covenant Children's, we're a regional children's hospital, and our mission is to take care of those rural communities that surround us throughout West Texas and even in eastern New Mexico. And so we're, prepared and ready to take care of the population. Yeah.
I think we're going to wrap things up real quick. We've had a lot of questions. Amy, since we have the opportunity with a lot of national outlets here, can you just explain a little bit more about Covenant Children's and who we are as this kind of medical oasis out here in Lubbock?
Yeah. So I don't know if they could hear the question, but we talked about we're going to probably wrap up this. Thank you guys so much for being here and asking the questions. And the question was related to specifically Covenant Children's. And so we are a freestanding children's hospital, one of very few in the state of Texas, and we're separated by a large geographic distance. I'm from West Texas, and I was raised in this area. And we talked about the rural, question. Everybody that's in Lubbock understands. My grandmother used to talk about coming to town. And what she meant was that we were going to go to Lubbock because this is the place that houses a lot of, shopping. I think we joked we have the most restaurants per capita or something. I think we're like in the top of this in the United States, but also on the health care for that. So Covenant Children's is a separately licensed children's hospital where we do take care of women and children specifically. And so we are equipped with state-of-the-art things and therapies for children. And so happy to be, I've been was a practicing physician there full-time for many years, was the chief medical officer for a year, and then have proudly been the CEO of that hospital since 2014, and then recently took on some responsibilities as well with the adult hospitals. But I have a long history with Covenant Children's Hospital and very proud of just the work that we do there and what we've tried to do to be that hub for care in West Texas, understanding our rural nature. Okay. All right.
If you guys would like to join us, everyone is welcome to the prayer service across the lobby. We can guide you over there. If you have any questions for Ainsley or myself, our communications team,